Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a segmental Scruples series or edition. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Robotics, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit of an overview in around healthcare and in regard to sort of red cell blood transfusion care and practices, and there will be terminology sort of in abbreviation. Two main terminologies throughout this series. Throughout this will be RBCs, meaning red blood cells, or RBT or RBTs, in regard to red cell blood transfusion. So the ability of red blood cells or RBCs to facilitate the transport of oxygen from the environment to mitochondria or mitochondrion has been repeatedly demonstrated in physiology research. The physical characteristics of red blood cells or RBCs and the properties that allow them to increase the solubility of plasma for oxygen the physical characteristics of RBCs sort of allow them to sort of increase the solubility of plasma for oxygen by an estimated 30-fold. In addition, the affinity of RBCs for oxygen is modulated by regional acid-base conditions to favor oxygen loading by the pulmonary alveolar capillary interfaces, as well as unloading at the tissue level. So at present, there are no clinically there are no sort of clinically available fluids or sort of modalities, fluids or modalities that have the loading and sort of the unloading and carrying sort of bases of, for example, of blood as a 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 main component in context of physiology, but also where within blood the sort of hemoglobin component, the sort of hemoglobin component. So clinical sort of interventions and the decision when to prescribe or administer RBT or RBTs is not always routine. Having an appreciation, however, having an appreciation and sort of the knowledge or the underpinning in around CKD or chronic kidney disease or in around CKD and or renal insufficiency from an intervention sort of perspective is important. Is important in the management of recipients or patients, because the kidneys or where in around renal function the kidneys have a sort of a main role in the synthesis of red blood cells through the hormone erythropoietin. And whilst the synthesis of EPO may not be compromised in patients in renal insufficiency, if there is evidence, however, of a reduced estimated glomerular filtration rate or EGFR leading to chronic kidney disease, this can potentially affect a patient's overall hemoglobin. with CKD prevalences are sort of increasing, scientists and clinical teams in amongst specialties such as hematology, transfusion, and sort of blood sciences in amongst sort of biochemistry now need to consider, or should consider, sort of further the renal health of all patients with long-standing conditions and all sort of chronic illnesses, and where RBTs may be warranted to achieve sort of best practice or best practices. That draws this audio podcast to a close. There will be a subsequent audio podcast that delves into the asking the question, why consider renal health in all patients, thus at sort of an underpinning sort of basis, irrespective irrespective of renal insufficiency. The audio podcast covers or goes into the basis in around considering renal health in amongst all patients, thus the general population in where sort of transfusion practices might be concerned. So that draws this audio podcast to a close. This being an audio podcast as part of the Segmental Scruples edition or series. This audio podcast as part of the Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.